that technical difficulty there. You heard our great introduction. Thank you, Lydia. All right, so let's get started then. We're going to talk about rehabilitation and what that all involves and what that can mean for you as an owner. And so basically, when we talk about rehab, a lot of people, that stimulates a lot of horror thoughts of stall rest and injections and shockwave and frequent vet checks, which it does involve that, but we're starting to figure out that our old thought process of putting horses in stalls for a period of time and then coming back to them in 6 to 9 months is not enough to get them back into their jobs. So what does that mean rehab actually is? It's definitely more than stall rest. The World Health Organization describes it as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Basically, it's a lengthy way of saying that we are trying to assist in allowing these horses to heal and then return them into their job at full function. So what does that mean? So that means that we need to pay attention to more than just the injured limb. It's a large picture approach that we need to do. So a lot of times, lameness is involved or is caused by more than just a bad step. So a great mentor of mine basically described it as most lamenesses happen because there is a bunch of bad steps leading up to the injury, rather than our old school thought process is, oh, they must have just gotten up wrong or they must have stepped bad. It's actually a bunch of small micro injuries that lead to the significant injury. So basically, we need to address why the horse is causing these micro injuries. A lot of that comes from compensation, from other weaknesses, or areas of pain. So healing the one spot doesn't prevent them from injuring it again. So we spend all this time and money on healing the tendon, and then we put them back to work, and then we end up with another injury if we don't address the whole athlete. So what makes a rehab plan work? I cannot stress that it's teamwork. The teamwork involves you as an owner, your veterinarian, and your farrier, as well as any caretakers of the horse. So a lot of times there is a large group of people involved in caring for the horse, and without everybody being on the same page, then you can lead to a lot of missteps. So and a reminder is that your farrier is as important to the team as your veterinarian and as you as the owner. So communicating well with your farrier and including them in the discussions on how your horse is getting rehabbed is going to be a huge help, because they are the primary factor in how your horse's feet are getting balanced well, and no hoof, no horse. So the first thing that I address when I have a rehab patient is I set up a consultation with the farrier and see if we can take a look at the horse's feet, and if there's any changes that need to be done for their balance, or just for their current condition. So the farrier needs to be brought up to date on, okay, well, now we have this injury, so we're going to have to change their balance a little bit or tweak something to help alleviate that for now. And then down the road, we'll have to start working on taking that back, but that will help the horse heal in the moment. But nothing helps your horse more than just proper hoof balance. So getting your farrier in on the team early is going to help you get your horse back as good as possible. We do need to tailor the program to the horse. That means that there's no cookie cutter plan. I think everybody likes to ask, like, hey, what exactly will my horse need for the next 6 months? The problem is that we are tailoring the program to your horse in that moment. So you might have a general plan, but you're going to need to have your veterinarian involved with frequent checks to make sure that your horse is healing according to plan. Certain horses may need to move slower than others. Certain horses may need different areas treated and addressed before you can push them into more work. And all of that will need to be addressed through frequent rechecks and your veterinarian. So unfortunately, we would love to have a cookie cutter plan and a magic ball to predict on when your horses are going to get back into full work, but that is a fluid process. And that means the patience is a huge factor for everyone involved. I get it. It is a very stressful time for everybody. And your veterinarians also, me as a veterinarian, I have to remind myself to be patient with the horses as well. Nothing's going to replace time. So we have to give our horses the grace of time to rehab properly. And we have a lot of technology available to us. So it is very helpful in getting our horses to heal better and come back into work stronger than we had before all these tools. However, we have a wide array to choose from, and each has its benefits and limits. So knowing when to use these tools to get the best out of them is also very important. So what are your options if you have the dreaded rehab question? Basically, I think the most common and most often way we have our rehab is basically at home with your veterinarian. So your horse's rehab program is basically you as the owner doing a lot of the grunt work and your veterinarian helping you formulate a plan and checking your horse and going from there. Our other options available are at-home consults with a rehab plan built by a certified practitioner and a veterinarian. That could be one person, or it could be a certified rehab practitioner in conjunction with your current veterinarian. I always stress keeping your regular veterinarian involved. It's going to be a smoother process and getting your horse back. And it's just very important for the veterinarian that knows your horse well to also be involved in the program. So if you're going to pull somebody else in, I would always recommend having your veterinarian be involved. And then the other options are to put your horse at a rehab facility. In this area, there's not a whole lot of options. There's my facility, and I believe there's Unbridled. And then your next nearest is Kentucky, or I believe there's a place in Michigan. But that is where they handle all of the rehab care themselves, and the rechecks are done either by your veterinarian or the veterinarian on staff. So what are the goals of rehab? The first and main primary goal is to alleviate the pain. We're not going to get anywhere if we don't improve the pain. And then our goal is to restore range of motion. So oftentimes with an injury, there's inflammation, and as a result of inflammation, there's a limited range of motion caused. So we're going to have to restore that range of motion. And then we reestablish the neuromuscular coordination, which basically is saying your brain sets up a defense mechanism once you have pain. So they're going to compensate for that injury. We're going to have to not bypass, or retrain them to start using their body properly by reducing the pain first and foremost, but also saying like, hey, you can use this now. We're going to have to stimulate your nerves and get the body to remember how to use that limb properly. And then we're going to restore the strength. And then at that point, start returning them to sport activities. And the main goal is to prevent re-injury. Nobody gets more upset than getting through all this hard work and then ending up back at the same spot again down the road. So that is our primary goal. Speaking of rehab tools, this is a busy slide. I'll go through a bunch of these separately, but basically it's to emphasize the point of there are a lot out there, and not all of them are tools or gadgets. Some of them are actually manual exercises and controlled exercise, etc., like that. All right, so the TheraPlate is whole body vibration therapy. It stimulates blood flow. It does reduce pain. The theory behind that is that when you have pain stimulated from an injury or inflammation, your body is going to be primed to keep feeling that pain. By moving other parts of your body, you're stimulating the brain and reducing the amount of signals sent from the pain or inflammation. So you're basically reducing the amount of perceived pain that way. So you're going to break up that cycle of, this hurts and I'm going to keep focusing on this pain. And so you're going to break up that stimulation cycle from the nerves. So I use it a lot in chronic pain situations. I do think it helps them in that, and it has been shown to maintain bone density. So for our stall rested horses that are stuck in a stall for a long time, I do like to put them on this a lot as well. And it does improve neuromuscular function. So basically, it helps their body perceive, helps their proprioception. So where they are in space, getting stuck in a stall, that tends to be effective because they're not moving around a whole lot. So again, this is a great tool for our stall rested horses to keep them maintained. I also really like it for hoof growth. And reducing back pain, and general pain or chronic pain. Laser therapy. There are a lot of lasers out there. I do think that if you're going to add that to your horse's program, that you have veterinary guidance, just because there are so many different classes and uses for it, that you're going to get the most out of the laser if you have a veterinarian involved in directing the treatment protocol. There are some at-home lasers that you can do. Those are typically lower class lasers, so 3 and below. I have a class 4. Basically, that just means that it's a higher power, essentially, and if used improperly, it can damage tissue, but it penetrates tissue a little bit better, but also you can get a treatment for the different injuries in a shorter period of time. A lot of times the lower class lasers can treat certain things fairly well. You're just going to be a longer duration of treatment. What the laser does is it stimulates healing at the cellular level. It enhances blood flow and the lymphatic flow and reduces swelling and pain. I love them for chronic wounds. I actually used it on this guy a lot. He had an open wound that was very hard to heal, and he improved a lot with a laser. It reduces post-surgery swelling and stimulates healing. So if we have any surgical cases that come in, I'll often use a laser on them to speed up the healing process. I use it a lot to reduce muscle spasm. So when I adjust a horse, if I'm getting a lot of back pain and spasm in the back, I'll do laser therapy and then go ahead and adjust them. And I also think it helps maintain comfort for horses with chronic arthritis or significant arthritis, or even mild arthritis. I have a couple chronic or significant neck arthritis horses that I maintain with the laser therapy as well as other things, but I do think they do well with the laser. And shockwave therapy, I think a lot of people are familiar with. It's been around for a while. It's sound waves, so it's a concussive force. It helps with reducing swelling, pain, and stimulating blood flow. The goal is to stimulate growth factors for proper healing. So a lot of times we use this in tendon injuries and ligament injuries to stimulate the cells in the tendon and ligaments to reform. And I use it a lot for back or neck pain as well, and chronic wounds. I've used it occasionally. I know a lot of other veterinarians will use it for chronic wounds to help healing, and it does have some success there. Massage and fascia release. So again, it's a manual therapy. What we're starting to learn is that fascia is a tissue that we've highly overlooked in veterinary medicine. It is a sheet of connective tissue that basically covers the entire body of the horse. It's highly innervated and connects the whole body. And studies have shown that fascia is more important in conducting pain than we previously thought. So a lot of times it can be involved in compensatory pain. So you could have an injury in one part of the horse's body in the hind end, and they can be compensating and have pain in their front end. So a lot of times I think you'll hear diagonal pair injuries. So a left hind, right front, that can be, I think that is highly associated with the transferred process from fascia. We'll go over myofascial planes briefly. I know that's like very detailed, but that is how that happens, I believe. Trigger points are basically painful knots. They're technically called densification in a muscle or fascia. And they can cause lameness, pain, compensatory gait changes, and poor performance. So I do address this in all of our rehab horses. I do think they have a significant effect on them. And if we don't address them, then they're going to continue their compensatory gaits on after we resolve the original injury. And when you get a trigger point, it can often be the first sign of a change in their gait pattern due to pain. So often on my rechecks, I'll be looking for these to pick up areas where, they're either starting to get sore again or weak, and we need to address. And it'll be our first sign that we need to start thinking of something else to address in the horse. So this is a detailed picture from a book by Jean-Marie Demois, just detailing the myofascial planes. So basically what I'm trying to show here is that the whole horse is connected. So we have a dorsal chain, which is made up of muscles and fascia from the top of the pole through the back to the hindquarters and hind legs. And then we have the fascial planes, the ventral chain connecting the core or abdomen from the hind end to the pole. So these basically have a huge influence on compensatory gait patterns, basically. Another tool is basically cold therapy. That could be simple as cold hosing or ice boots, or you could have the combination of cold and compression. Tool that's already made out, or a system that's already out there, is Game Ready. I actually do have this and use it in our horses. We usually do about 20 minutes, depending on the injury. It's either several times a day or just a couple times a day. I love cold hosing or just cold therapy in general for immediately after the injury. I try to limit it to about 2 weeks, frequent use of it for about 2 weeks. Studies have shown that beyond 2 weeks, we're starting to actually limit healing if we're doing it too frequently. So I try to save the frequent use for early on to help the swelling and soreness and inflammation that's going on in the acute phase. And then after that, we start using it sparingly. I also like to use it after immediately after exercise. So if we're getting our horses out and hand walking for longer periods of time, then I'll go ahead and ice boot them afterwards. I also think this system is great for our lymphangitis or cellulitis cases, because you're getting a combination of compression and cold. So I really do think these systems do well with our cellulitis cases to get a good response quickly. And then we're getting into the pulsed electromagnetic field therapy, or PEMF therapy. A lot of times you'll see the magna waves floating around, or the beamer blanket is also floating around. These are two classes of the same therapy. So basically, there's a low frequency, low amplitude, and high frequency. In theory, they're supposed to help restore optimum cell membrane potential and the cell to its normal functions. It's been helpful in arthritis, managing arthritis and muscle injuries. Excuse me. I tend to avoid the magna wave system in spastic muscles. So if you have a very painful muscle injury, I'll actually delay the use of the magna wave. I think it actually can cause them to be more sore afterwards. I tend to go for the lighter, lower frequency PEMF treatment, if that's what we're going to do, which is the beamer blanket. Or I don't know if you've heard of the Assisi loops. That's another low frequency one that I like to use. But just something that I have noticed in my experience is that the magna wave can be a little bit too much for some of these acute, or like right after these muscle injuries. So how can you use rehab to help your horse now?
Dr. Iverson, I'm going to jump in. We have, I don't have a watch in front of me, like 15, just over 15 minutes left.
Okay.
I think we should go a little over because we started late, but
Sorry.
just out of respect for the people that are on, I don't want to keep them much after 8. So maybe like like 20 more minutes. Do you think you
Okay.
can do it?
I think so.
Okay, thank you.
Yeah. So we'll kind of speed through this. But basically I am a huge proponent of scheduling routine soundness exams. I think we're trained a lot in having your veterinarian out for a lameness exam when your horse is lame. I think we need to start getting a little bit more proactive in having your veterinarian out to see your horse before we get to that point. And we can address areas of weakness or pain before they become an actual injury. When I say determine habitual gait patterns, that's a compensatory gait that they are doing for either a weakness or compensating for pain somewhere. So that goes hand in hand with the soundness or performance exams. Allowing a proper warm up and cool down time is probably the easiest thing you can do and add into your program right now. Usually I say 10 minutes of walking, warm up and cool down. That is very important in allowing the tendons and ligaments to warm up so you can prevent injury. Incorporating exercises to strengthen their balance and reflexes. That could be as simple as taking your horse on a walk and going over a little bit of grass and then back onto their driveway, just a little serpentine. Doesn't have to be very long, and I'll always keep your horse's temperament in mind. Don't want them running away on asphalt, but at least a change in surface is very helpful in preventing injuries. Working with your veterinarian and farrier to have good hoof balance is also very important in preventing injuries, and then know when to call your vet. I'm just going to speed through basically the conditioning exercises. I'll do the video to show some of the stuff we're doing. I'm going to try to mute this before we do it. So core exercises, we're always trying to strengthen the core because that is a huge group of muscles that are important in supporting your horse's back. So this is a thoracolumbar flexion exercise to help engage the core. If I can help have it play. Maybe, maybe not. All right, well, we might have to skip the videos today. Sorry about that. Another thing that's very easy to include, I think a lot of times we get focused on encouraging our horses to train in a shortened or collected state. We need to start encouraging lengthening exercises, which I think you guys as a group tend to do very well. I think we as hunter jumpers tend to not do that very well. So including acceleration and collection exercises, gymnastics or ground poles, those are all important. Cross training essentially is very helpful for these horses. And then, oh, there it goes. So basically what I'm doing is running my fingers down on either side of their sacrum, which I don't know if I can go back for you guys to see that. No, okay. In the still picture, you can see where I'm starting, and then I run down on either side. There's a groove in between the muscles on either side of the tail that your fingers will just fit in, and we're just kind of scratching lightly. And oftentimes we want to see the horses lift their back. And I would love to go back and show that better, but we want them to lift up through their back and kind of tuck their butt down a little bit. If they're squatting and bending at the hocks, then there's a soreness that is in their either SI or lumbar area that needs to be addressed. So if we're adding this exercise, also be very careful where you're standing. You want to be on one side or the other, not directly behind your horse in case they're unhappy with it.
Videos don't work real well with Zoom, so it's not a good idea to try them even.
Okay, so we'll skip over these. Oh, here we go.
Oh, look at that.
So these are, I'm sure a lot of you have heard of the like carrot stretches, or we're trying to get their neck to stretch. The goal is to try to keep their ears level until they reach their shoulder. If they're tilting their head or coming down, kind of like how he's leaving this stretch, that means that they're not doing it properly. They're cheating for either like a weakness or soreness in the neck. So we try to get them to only go as far as they can properly do it. So if you're adding these in, just pay attention to where your horse's ears are. And then there's a nose to chest. He struggles with this. As you can see, he's trying to cheat. That stretches the pole and the upper part of the neck and withers. If we want to go further down in the back, I would have them come down to their knees and then come down to their fetlock. And you don't want them to bend the knee to try to get to the treat. So, and the goal is to have them do it slowly and not just have them throwing their head down between the legs to get to the treat. So I start at the lowest, at either with grain or hay, like not the highest value treat, so that they're not throwing themselves around just to get the treat. So start low and see how encouraged they are to use it. So again, stretching exercises here for the forelimb and shoulder, hold them for 30 to 60 seconds. We'll probably skip over habitual gait pattern, but basically it's poor biomechanics. So, which it is basically the basis of that statement that I said earlier, that lameness is caused by a bunch of bad steps, which means they're poor biomechanics. So catching these early in the process are important in preventing injury. So quickly, this guy is standing with his front feet underneath himself, which typically to me either says heel pain or neck pain. And then he also has his hind end, not too bad, but underneath himself, which could also be some back pain or SI pain that need to be addressed. And going around like this can lead to more force or concussion on the lower part of the leg, so they tend to lead to injuries. Typically, well, basically this is to demonstrate. So this guy is standing obviously not square, which is the goal here. His head and neck are up, so he's not using his core. He's hollowing out his back and standing with his right hind behind himself, so he's not utilizing himself very well. It's hard to see in the picture too, but he does have one foot that's taller than the other. But you can see in his stance, he's leaning on the right front, which means that he's bearing more weight on that. That's his lower foot. And down the road, you can see that bearing more weight on that can lead to an injury. So these are balance pads that we get to stimulate their reflexes, to kind of, basically the goal is to awaken their nervous system to say, hey, we want you to stand on this other leg just as much as the other one. So you're training their balance, but also stimulating their nervous system to remember about this other leg, that they can balance on it. And because he's square, you can see his head and neck is down. He's starting to use his core more. And hopefully down the road, we'll start to have a more natural stance like this. We'll probably skip over this because I think you guys all are pretty familiar with chiropractic or veterinary medical manipulation, and for intents purposes of time. I think it's important to know when you should call your vet. This is a little bit more difficult to see in the picture here, but it's demonstrating a tension line basically in muscles. You shouldn't see a division between this muscle here and this muscle here in the neck, the splenius. When you start to see, here I can go back to this guy even. These shadows or divisions in the muscles, that is usually a sign of soreness or restriction. So having your veterinarian or chiropractic certified veterinarian look at that would be important to call them. But basically poor performance. So if you're having difficulty with lead changes or lateral work or landing on a lead, or your horse is falling in on turns, like these are all signs that, yeah, it could be training, but you might benefit from having your vet look at your horse and do a soundness or performance exam to figure out if there's something that needs to be addressed that will, one, make these all easier for you as a rider, two, but also help your horse perform better and stay comfortable. If you notice them leaning in a direction or another, muscle atrophy is the first sign of pain. So if you have a injury or restriction, that is going to be the first sign. So if you start seeing an imbalance of your horse's muscles versus one side or another, that's another thing to maybe call your vet out and have them take a look. We're going to skip that. So basically I just have 2 cases that I went over. I don't know what we were at for time, if you want to stop for questions or if you want me to go over these.
I would say if there's any questions, if people could put them in the chat. I do have one. The pads you had under the horse's feet, are those the Surefoot equine pads, or which ones do you use?
Here, I do use the Surefoot equine ones, but I recommend to my owner, they're actually they're called I think the brand is TheraBand. You can find them on Amazon. They do very similar. They're basically just as effective and they're a lot cheaper.
Gotcha.
So they have, the only downside to them is they don't hold up quite as well to the feet for as long, but
Yeah, because they're not made for horses. They're made for something else, right?
yeah. They're basically for people, but
Oh, okay.
I think they hold up fairly well. I mean, if you're using them every day for a long period of time, they are going to go down, but.
So it looks like it's 5 till 8. Let's go like 10 more minutes, and we'll end at 5 after. So whatever you have left that we can cover in 10 minutes, maybe one case, like 5 minutes a case. Will that work?
Sure.
Yeah, let's do that.
Okay. So this guy is a teenage, so he was 17-year-old warm blood that injured his right hind suspensory branch. He also had poor body condition in the beginning here. This is when we first had him in. This is a staging photo, so we're looking at his SI because it's a staging photo, but he hurt his suspensory branch and we kept him in our clinic for about 4 months. He did a significant amount of damage to that branch, and it was a question on whether or not he was actually going to return to work. We did Renovo therapy, which I don't know how familiar you guys are with that. It's a amnion. It's proteins collected from amniotic fluid, stimulates the growth. It's along the same lines as Prostride or PRP kind of treatments. We're basically stimulating the body to heal itself. So we did an injection of that, a couple of shockwave treatments. We did a lot of our core strengthening exercises, hand walking, and conditioning work, and nutrition. We also addressed his neck and back a lot because he was, I don't know if you remember him from an earlier slide, but he was demonstrating a compensatory. I mean, he's not perfect here. We want him to be a little bit more forward with his legs. He's kind of in the process of moving in this photo, so I think I'm going to give him a little bit of a grace with that. But you can see that he's standing a little bit further underneath himself. Our muscle is a lot better. We're using our back and neck a lot more. And we do have some tension lines that need to be addressed, but this is between these photos, it's 6 months. So we got a huge progress, and he is back into full work, actually, much to all of our surprise and happiness. So this guy benefited greatly from basically, I think, mostly our traditional way of rehabbing a tendon, but also including the core exercises and stretches that you saw earlier, and the grace period of time. So this guy, I'm going to try to quickly go through him because he has a lot of problems. But he had significant white line and rotation in the left front. He had a injury in the hock, an injury to the collateral ligament, and had just come off of the track work. So we had a lot to deal with as far as weight and nutrition as well. These were our feet at the point in time that he came to us. We spent a lot of time rehabbing him. We were soaking his feet with clean tracks to try to get the white line addressed. He had a secondary complication from the surgery of the collateral ligament injury, where he had a deep suture infection. So that was the wound and everything that we were trying to wrap and heal with the laser. These are his feet. So between this slide and this slide, I know they're casted over, but his feet are much better balanced. And that was about 6 months again. So feet take a lot of time to address, but we definitely made leaps and bounds. I wanted to pull up his x-rays for you guys, but I got distracted with our technology issues. And then this is him now. So we are about a year out from this injury, but his whole body has changed, simply with our rehab and core strengthening exercises, addressing other parts of his body. We did laser therapy on the hind leg for the wound, but also for the ligament injury, and then basically just good farrier work for the feet, and then added in nutrition and core exercises as well. And he was a as I would say, low tech rehab, and this is what we have. So you don't need a ton of gadgets and money thrown at them all the time. It's nice to have those options, but if you don't have the budget for it, you can still get a pretty significant improvement. You just have to have the time and commitment to get the exercises done on a consistent basis. So that was kind of my point with this guy. But that concludes my.
Well, he looks amazing. I can't even believe he's the same horse. The way he's filled out and squared up is just, and he looks so much more balanced and comfortable. That's crazy.
Yeah.
So.
Yeah, I'm pretty proud of him. He's
yeah,
come a long way.
Yeah, great job. Any questions or thoughts from anyone? Throw those in the chat like we did our voting on the pies.
Are there any questions in there? I don't know how to. Let's see.
Well, if there's not any questions, then I think we can thank Dr. Iverson for her time. We can thank her husband for his technical expertise. And this will be, Molly, you might want to jump in, you know all the details, but this will be posted, uploaded soon to the IDCTA website. And is it members only that have access to it, or?
Yeah, once we put it on the website, only members have access to it.
That's right. Okay.
We don't charge anything for these vet Zooms at the time we do them. But the one advantage of being a member is that you get to go back and look at the 25 or so Zooms we already have on the site.
Yeah.
Okay, so we've got about 10 on vet topics, and we have a whole bunch of them on rider topics.
Mhm.
And we're soon to have ones on the new tests for dressage that are coming out this year. And they should be posted in the next scribe. So you'll see those very shortly, and
Cool.
you'll be able to sign up for them. And that for non-members will have a charge, but not for members.
Yeah.
So,
Awesome. Well, Dr. Iverson, now that you are a pro at, sharing screens and giving Zoom meetings, we'll have to have you back to another topic, another session. So, well, thanks for,
thank you very much.
Yeah. And I know the ones that showed up, got a lot out of it. I certainly did. And you have a good night. You can
Thank you.
relax. And there was a suggestion for my Thanksgiving to have white wine. So may as well start tonight.
Absolutely. Thank you
All
guys for
right.
having me.
Thank
All
you.
right. Thanks, everyone.
All right.